thank you for accepting this invite. Several gene mutations: MTHFR C677T variant,
Yeah.
HLA-DR, hyper IgG deficiency, Babiesiosis, methylentrephedrofolate reductase.
Oh, that's the MTHFR.
Okay, gotcha. Human lysocyte antigen.
That's the
That's
HLA-DR.
HDR. Okay. HEDS, so hypermobile Ehlers-Danlos syndrome, congenital Lyme disease, compromised immunity, detox work, comorbidities, gastroparesis, mast cell activation syndrome, POTS or post orthostatic
Postural
tachycardia syndrome, small fiber neuropathy, specific antibody deficiency, inflammatory basal ganglia encephalitis, epilepsy, dysautonomia, rapid eye movement, sleep behavior disorder. You're a registered nurse. You've got a bachelor's of science in nursing, obstructive sleep apnea, oncology certified.
That's a huge issue for Lyme disease patients, is a reason why people become chronic. One reason is oftentimes they're living in mold and they don't know it. Fun fact, not so fun. But anyway, so I got really sick when I was 14. When I was a toddler, preschool age, I don't really have much of a memory. So I was symptomatic of Lyme on and off, but doctors kind of just dismissed it because they couldn't really figure out like why I was having chronic UTIs and yeast infections and stuff like that. And I would get so much better, like be completely normal and healthy again. So it just was never, the only person concerned at that point was my mom. But then when I was 14, I pretty much just woke up after I graduated 8th grade in severe knee pain. And it progressively got worse to the point where I couldn't walk anymore. And I ended up having 2 knee surgeries, and they still didn't know what was wrong with me. And so then by the time I was 17, I had seen dozens of physicians already. And by that point, I had systemic issues like mental health issues, weight gain, chronic crippling fatigue, like super symptomatic would be Babiesiosis, like drenched sweats and Dysautonomia, and just really awful at that point. Like it all happened so quickly. But I just kept getting sicker. And then finally I was blanket labeled with fibromyalgia. And I say that because they didn't bother to try to rule out all of the things that are usually the root cause for the symptoms of fibro, like infectious diseases and like tick-borne diseases and connective tissue disorders and small fiber neuropathy. Like those are usually what, when someone's diagnosed with fibromyalgia, those are usually what they actually have. And it's just like, if you don't get the proper diagnosis, then like the treatments aren't going to be effective. And that's what happened in my case, is I just kept getting sicker. Nothing worked. I did homeopathic medicine, Western medicine. Like I tried everything from the best of both worlds. And then finally, when I was 26, my primary as an adult, he just had been doing so much research in like what European doctors were doing for treatment for like complex chronic illnesses. And he's really into root cause medicine. And so his focus kind of ended up in Germany because they're very, innovative. And that's actually one country that takes tick-borne infections seriously in this world. And so I guess that's what like stumbled him into the world of like, wow, Lyme disease mimics 300 other diseases. Like we're really not diagnosing people properly. So then he was like, you know what, I'm going to test all my sickest patients. We had different diagnoses at the time. But he was like, none of them are progressing or making progress like they should be. And so then he tested all of us with IGeneX, and we all came back positive for different tick-borne diseases. And we live in Texas, so a lot of physicians still to this day like to pretend that we don't have issues with tick-borne diseases here, which is just, it's not even misinformation, it's disinformation, because you can't be saying that ticks and the infections they carry aren't existent in every state, because they are. The data's there.
Yeah, really.
The education doesn't get passed on to doctors.
Wow.
yeah, so when I was 26, I finally got diagnosed. And then I treated with my primary for a year and a half, and I didn't get any better. So then I started seeing a Lyme literate physician January 2020. I always knew I wanted to go into medicine in some form because my dad's a dentist and my mom's a nurse, and my grandpa was a dentist, and my brother's a dentist. And I originally was pre-dental, but so I'm on Keppra, so you can't tell now, but I used to look like, I was like this, like Parkinson, so I was like, okay, I obviously can't be a dentist with uncontrolled tremors. So I switched that summer, like my freshman summer of college, I went home and I was like, what do I do with my life? And so I like mused over it for like a month, and I was like reflected back on like my whole journey in high school, because I had been sick for like 5 years at that point. And everything kept taking me back to like how much my mom sacrificed everything in the world to help me. Like she devoted all her free time to buying all the books about like fibromyalgia, chronic complex illnesses, like chronic fatigue, like just trying to figure out like, why is my kid so sick? And no matter how many doctors gaslit her or told her she was wrong, because she did ask for me to be tested for Lyme disease and Ehlers-Danlos by that pediatric rheumatologist, and he said Lyme disease doesn't exist in Texas, and she can't have EDS because her skin isn't super pliable.
Elastic enough.
But he didn't even do like a Baton scale or a head to toe family history, none of that. Like it was just super egotistical, dismissive. And I was 17. My mom, it was still early in the game of 3 years of fighting for her kid, advocating. So she just like dropped the pursuit. She was like, well, he must be right. Like I was misinformed.
Yeah.
Just second guessing herself. But anyway, it's just my mom, even to this day, like never gave up on devoting her life to advocating for her child. And I know a lot of medical moms are like that, but I think for me, it was just like, I saw it from not just a mom perspective, but like a selfless nurse and advocating tirelessly because she wasn't going to let doctors tell her and her kid that, her kid was just exaggerating or it was all in her head and, etc. And it made me want to be that same fierce advocate for other people who were suffering. And then and I think at that age, I'd been sick long enough to where I also realized how horrible ableism and how rampant it is. I didn't realize how bad it was like in healthcare at that point, but just from like my experience as being a disabled kid, it was just like people could be so heartless and cruel, and I just didn't want other young people like in the hospitals to have to feel that isolation and fear. And so that's why I ended up starting in oncology, because I just wanted to be able to connect with patients who were suffering immensely, mentally and physically, and isolated in the hospital and scared. And it's like, I've been there literally in the hospital bed. So I just felt like it would make me like, I just think disabled and chronically ill people make the best healthcare providers. I don't have a problem like standing up for myself and telling people how it is. But it was definitely something that like ate me alive and made me so angry in high school, because it was just like I hated hearing it. So I cringe when I hear like newly sick people still hearing it from like their friends and family, and it's just like, oh my gosh, like it's been 16 years and people are still talking to people like this. But I've learned like just simple phrases like, okay, well then what does sick look like to you? Like, sick doesn't have a look. And I always remind people over 90% of disabilities and chronic illnesses are invisible. Like, please try to address the ableism and sit with it. And I was like, you may not mean harm, but just like you have to do the work to be anti-racist, you have to do the work to be anti-ableist. And so it's not, if you tell that just straight up to someone and say like, hey, like we're brought up in a society where disability is viewed as something negative and bad, and there's so much bad connotations associated, like us being lazy and stuff like that, which is obviously not true. So it's like to challenge them to relearn and say like, why do you have those thoughts? Like, let's, try to redirect it and not place the blame on the person, place the blame on society being inaccessible and not accommodating. And so I think if people genuinely care and they want to support you, then they're going to hear that and be like, oh my God, you're right. If they get defensive, then like, is that someone you necessarily even want on your team? Like, I know it gets more nuanced when it's like people you have to rely on for like safety, like parents and siblings and stuff, or a partner. But as far as just like people in your social circle, like if they're not a ride or die when you become sick, like, they're not worth it. Like, sometimes you just have to let some people go. Like, it's worth educating, but some people are not worth your energy because you don't have the spoons for it. You can call it out gently, but it needs to be called out, or we're never going to progress in the way that we treat disabled people. We have to stand our ground.
Yeah.
But also protect your energy at the same time. My main issues like started from the fact that I got Lyme disease in utero from my mom. So congenital Lyme's passed from pregnant person to fetus. And then it's not uncommon for you to just be mildly symptomatic or asymptomatic and throughout your life until you're exposed to like something acutely, like a trauma or another, like, or you get COVID, because some people who are becoming long haulers have reactivated tick-borne diseases, things like that. And then the hypermobile Ehlers-Danlos. So Lyme is a bacterial infection. It's a tick-borne disease, most common vector-borne disease in the country. And then that being untreated is what led me to develop basal ganglion encephalitis, which is a form of autoimmune encephalitis when your brain starts attacking itself. And one of the subtypes is basal ganglion encephalitis. So that area of the brain that can control some of your motor movement and your emotions, and like impulsivity, that's that area of the brain, and it gets inflamed, and it can manifest in so many different neurological and psychiatric ways. And then, but it's also commonly misdiagnosed. And then because that went untreated as well, from Lyme invading my blood-brain barrier, I developed epilepsy. So like those two comorbidities, my doctors think it's nocturnal epilepsy specifically. So I'm only having the seizures in my sleep or right when I wake up. So my mom thinks I've been having them since high school because I would do like this in my sleep or like lift my leg up and then she'd put it down and then I'd like go like this again. And then my ex-boyfriend, it was a year now ago, he said his alarm went off one morning and I jumped up. And then I like passed out and he picked me up and then I stood back up again and I passed out and hit my head or thought I passed out. And he was like, oh, it's her POTS. Like, let me just put her in bed. And then he came back in the room after he showered and like I was you couldn't talk to me. I was not conscious. I was tremoring from head to toe, like diaphoretic, incontinent, had pooped and peed. And like couldn't get me to respond, and so he called my mom. She's like, she's having a seizure. Like, call 911. Yeah. So that's when I finally got diagnosed with epilepsy. I had been diagnosed with basal ganglion encephalitis, but we still hadn't had a definitive epilepsy diagnosis because it's so common for EEGs to be negative. But that was like, since it was someone actually saw it happen, they were able to finally like get me into a new neurologist and everything. Anyway, and then hypermobile Ehlers-Danlos syndrome is a genetic connective tissue disorder. I've noticed a lot that in general, I think with Lyme and EDS, there's a strong hormonal component that we just don't understand yet because the science just isn't. AFAB medicine is just not there. Like, we don't study female bodies the way we do with men's health. So I noticed a lot of us didn't really become disabled by EDS until we hit puberty. And so I would say those two things together, because they both, Lyme and EDS, can cause the immunosuppression. And then I developed gastroparesis by the time I was in like high school. I got diagnosed in undergrad.
Which is?
So I have partial paralysis of my stomach. Some people can be gastroparesis, like a lot of chronic illnesses, have such a disease severity scale. And so some people, it can be as mild as like, oh, I get really bad heartburn and I spit up and I get nauseated when I eat. I mean, which is also awful, but it can be mid-scale like me where I get chronic constipation because my gut motility is so slow that food will stay in my stomach for up to 12 hours. And then obviously that ferments and more bacteria starts being produced. So then you have to deal with gut dysbiosis and SIBO all the time, and vomiting. And then it can be, and I'm just a moderate case because like I can still eat everything by mouth. I don't like have to do infusions.
Tubes, inspiration, yep.
But then some people, it's so severe that their stomach's completely paralyzed and they have to get like a gastric stimulator, or they have to be tube dependent.
Mm-hmm.
So it just really, and then like those people in the severe cases, like their electrolyte imbalances are so bad that they end up being in and out of the hospital for IV, like potassium. And it's just like, I'm not that severe at all. Like I could do fasting for 2 days and like I wouldn't have any like hypoglycemic issues or electrolytes. But it just varies. But Ehlers-Danlos and Lyme gastroparesis can be caused by either one. So it's like, for some people like me, it's like, how will you ever know?
Connection, yeah.
And then kind of the same with dysautonomia. I've always had orthostatic hypertension. So when I stand up, my blood pressure gets really low and I get lightheaded. And I've always run like 90/60, which is healthy. But when you stand up and then you go to like 70/50, you know, that's not as good. Or that's not good,
You're
period.
talking about POTS, right?
Yes.
That's the, yep.
So dysautonomia is like the umbrella term for autonomic dysfunction. So your nervous system, bodily functions you can't control. So like your respirations and everything with breathing, your GI functions and bowels, and other organs. So gastroparesis can be from damage to the vagus nerve, which is part of the autonomic nervous system. And then same with POTS, postural orthostatic tachycardia syndrome, which is one subtype of dysautonomia, that probably one of the most common. And that's something we're seeing a lot more prevalence of with long haulers, because it's a common post-viral disorder. So for me, we figured out that even though POTS is common with Lyme disease patients and Ehlers-Danlos patients, I finally found a treatment for Babiesiosis, which is one of my tick-borne infections. That's a parasitic infection that's intracellular into your red blood cells. So when I did a treatment called supportive oligonucleotide technique for that a year ago exactly as well, my dysautonomia symptoms within like a few weeks were like started improving dramatically.
Wow.
And I had a flare like 2 weeks ago, and I got really scared. I was like, oh my God, I'm relapsing with Babesia, but I went back to baseline. So like, I still have POTS, but once I hit the right infectious trigger that was making me super symptomatic, like I'm not debilitated by it at all. Like I don't get the tachycardia standing up anymore. I don't get the drenched sweats. I don't have anxiety. I don't have blood pooling. It's really just the blood pressure that's the issue, but that's something that you can manage, you know, like compression socks, standing up slowly, things like that. So I am very thankful that I was able to find the exact trigger for my dysautonomia and then work on recovering it, because I know that can be so debilitating for a lot of people. And then the gene mutations aren't necessarily like a big deal in the grand scheme of things, but the HLA-DR means that people who are immunocompromised, like we don't fight off environmental toxins well. So people, 1/4 of the population has this gene mutation, HLA-DR, and we can't detox mold spores from our body. So mycotoxins, that's when the mold spores become dangerous in the body. So, and then the EPA estimates that half the buildings in the country have mold in them, and we just don't know. Like it's its own crisis. Mm-hmm. So that's a big reason why some people, like a lot of people who are chronically ill, stay so sick, because the mold contributes to your immunosuppression, and then you get all these other opportunistic infections like candida and stuff like that. So living in and out of mold is part of what made me so sick on and off and made me kept relapsing with Lyme. And then the MTHFR is just, I don't methylate well, so I have to do IM injections of B12, and that actually also helped my fatigue a lot too. And it's just when you are already chronically ill, you've hit your toxic bucket already and overflowed. So like being exposed to endocrine disruptors, BPA, perchlorate, heavy metals, industrial toxins, glyphosate, all of that, physicians still don't want to acknowledge that our livers and kidneys and lymphatic systems like weren't designed to fight off 30,000 chemicals that are human made every day. So when you're already chronically ill, you've gone over the edge of what your body can handle for your toxic bucket. And that's why some people develop like mast cell activation syndrome or multiple chemical sensitivity, because they're not detoxing these burdens out of their body. So for me, I had to do a lot of like enemas to start getting my bowels going because of my gastroparesis. I had to do a lot of like herbs for the gut overgrowth, infrared sauna, dry brushing, just getting my lymphatic system going. Just because like I couldn't improve with Lyme disease if I was still full of mold and lead, because we
Mm-hmm.
had lead like leaching in from our piping in our house. And yeah, I mean, it took me 29 years to finally get diagnosed like with everything, but we finally do know like every single reason why I'm sick and why I have every single symptom that I have, which is
Wow.
amazing. But it's like, wow, it took 29 years. I've always been passionate about raising awareness because even when I got sick at a young age, like I was never afraid to be like, yeah, I'm chronically ill and disabled. Like, what you gonna do about it? Like, like I
Yeah.
didn't let like, I mean, kids
Yeah.
weren't really even that mean to me. It was honestly more adults who were ugly to me than kids. Like kids
Really,
just,
really.
kids just want to be friends with everyone.
Yeah.
But I mean, there were some peers who were just like, well, if we don't understand, then don't talk about it. And it's like, that's not how life works, but okay.
Yeah.
So I have always been passionate about sharing. And from a young age, people were always receptive to it. Like, thank you for being vulnerable and helping me understand. And then it got to a point where like, finally I was able to start meeting other people who were like, I literally, like the words you say are how I feel like in my soul. Like it makes me feel seen. And it's like, that's all I
Mm-hmm.
wanted as a sick kid was to know that there was someone else who knew exactly how I felt inside and how lonely and scared and angry and frustrated I was at the system and the world and ableism. Um, and so I think just being so passionate about all of that, by like, that led me to be a nurse. And then once I was a nurse for 2 years when I finally got diagnosed with Lyme. And then even at the time, I didn't know, like, yes, I knew Lyme could be chronic, but I didn't know how serious and debilitating it was and how treatment resistant it was. So
Mm-hmm.
once I learned all that, I was like, okay, this is my life mission now. Like it took me 26 years to get diagnosed properly, but 12 years from onset of debilitation. And I was like, I realized how common that story was. And it's like, I come from a medical family, financially stable parents. I also have the privilege of being white. So I just automatically have better access to healthcare because I don't deal with the additional burden of like
Yeah.
racism. And I'm also cis het, so I don't have to deal with like dealing with homophobia or transphobia. So it's just like, I recognize the privileges I have that other sick people don't. And I'm determined to not, I don't want to like say be a voice for them because we're not voiceless. We can all speak for ourselves, but it's just like,
Right.
I want to amplify the way that other people are feeling and get them answers. Because I've had such better access to care, I try to share like on my social media like every treatment option I've done, what no matter how cheap or expensive, because it's like you never know who can afford what and how it can help. And I'm just so passionate about sharing all of this because the information is not easily accessible. And even when you do like simple Google searches of Lyme disease and Babiesiosis, like you get straight up disinformation from the CDC and the IDSA. The IDSA is Infectious Disease Society of America. There's a lot of corruption. So I feel like since I do have the educational background, people do take me more seriously now when I advocate. So I found that TikTok's like a super great way to try to reach medical professionals and other sick people who are searching for answers. So I'm very driven to just like help people get answers so that they can, because having a diagnosis is a privilege. It shouldn't have to be a privilege, but it is. And I just want other people to get those answers so that they can start getting help. I am thankful that when I had my knee surgeries at age 15, that my surgeon was very honest with me, and he was like, Jeni, the damage is so extensive that you will probably never run again. He was like, you can't walk up the stairs for a full year. You're going to be in a wheelchair for a while. You're going to have to learn to walk again in a pool. Like they were very invasive surgeries because the Lyme did so much damage to my knees. So I had to hear it within a year of getting sick, like, hey, you may, like, we are still going to try to get you like better quality of life. But, and I still, like, we didn't really know it was wrong. So like, I never thought about like, oh, am I going to be cured? Because it's like, cured of what? I don't even know what I have.
Yeah. Yeah.
So, but hearing from such a young age, like, hey, you're disabled now, like, and I thankfully I have supportive parents, so I didn't feel like shame or anything like that. and like my peers were supportive. But it was hard being 14 or 15 then, being told like, hey, you're an athlete and you're done. Like, good luck with varsity. You're not playing varsity. You're not going to play in college. Like, so that was the hard part, I think, was like
Yeah.
trying to accept that. And like my mom put me in therapy to try to, cope with like the anger of it. And so, of course that helped. And I was lucky to have a lot of peer support from people that I had known my entire life. So it was like, I went to Catholic school, so it's like kids I'd known since I was 4. So it's like, why would they like start being cruel to me when I was in a wheelchair like 10 years later? Like I was in a
Yeah.
safe environment. And so I basically, my point is like I was able to accept like, hey, you're going to be disabled forever. It is what it is. Like, and over time, as I've gotten more involved in the community and like become obsessed with advocates like Crutches and Spice, to where it's like, my disabled life is worthy. I'm not the burden. Society is the burden. And like, I want everyone to know that and understand that and feel that. Everyone who's sick and disabled in their soul, I want them to feel the same way, because we are not a burden ever. And we never have been and we never will be. And then the other part is my parents always told me like, we promise we'll never give up, and like, we're going to figure out what's wrong. And then when I started seeing my adult primary at 19, the amazing doctor, who just never gave up, that's the other thing, is like, doctors don't realize how impactful their simple words are of
It's true.
encouragement. And he always told me, like, because I would be so defeated all the time, like 9 out of 10 pain, like crippling fatigue, just like sometimes I could only work part-time, like I was just miserable. And he always told me, like, I promise, Jeni, like, we're going to find out why you're so sick. Like, please don't give up. We're going to get you relief. And like, as simple as those sentences were, like, it was enough to just have one doctor say, like, I'm not giving up on you, so don't give up on yourself. And he also encouraged me. He's like, Jeni, you're a nurse. Like, I want you to use your knowledge and like dive into these diseases, because you have more time than I do. Because he's got like 1,000 patients in a primary practice. He's like, you have more time. I got you your diagnoses by the time he got me like Lyme, Babiesiosis and stuff. He's like, but now it's your turn to like dive further on your own. And so then that's what I did, and like started buying all these books about Lyme and
Yeah.
other kidney
Learning.
diseases. So I think it's a little different for me that I just went through a different process of accepting disability at such a young age. That it's kind of hard to know what to tell adults with like a late adult onset of disability. Not that I don't know what to say. It's just like, it's just a different experience. But I just really want people to know, like, you're going to face gaslighting and ableism and disbelief and all of that crap. But you just have to keep the positive affirmations to yourself and know that those words are a reflection of their own insecurities and their own misunderstanding. Like, it says nothing about you, the disabled person. Growing up with a mom who always told me those things is what really helped. Like, I know a lot of my journey is my own strength, my own resilience, and my own will to fight. But I could not be at this point if I didn't have my mom. Like, there's no way. I never accepted that, like, oh, I'm going to be this sick and miserable and have no quality of life forever. I was like, that's not happening. Like, I'm not giving up. So my goal, even from high school on, was always just, I never even really thought about, like, a cure itself. It's just like, am I always going to be this sick and miserable and hate life? Or can I just get symptomatic relief? So even all through adulthood, my goal was just like, I just want a better quality of life. I just want to be able to work. I want to be able to have a social life. I want to be able to sleep. I want to be able to eat, like just the basic things, for chronically ill people. And I have that now. It took 16 years, but I'm 70% now. And I would love to improve more. But if this is where I'm stuck forever and I'm not giving up, like, I'm going to keep fighting for remission. But I haven't felt this healthy since I was a child. So I'm not complacent, but I'm content. Like, I am at peace with how much progress I've made. And from that, I feel like it's just, I wouldn't ever say that I'm grateful for having these infections, because they ruined my life point blank. I never had a childhood because of it. And like, I mean, my parents and my brothers have PTSD just from like seeing their child and sibling be so sick at such a young age. But I definitely firmly believe in finding a purpose in your pain. So while I'm not grateful that I've been through hell, I am grateful that I'm on the other side and that
Mm.
I can be a source of hope for other people. And it's like, I don't want to be inspiration porn for ableds, but I want disabled and chronically ill people to see that life is worth living and that we can make progress and that we really, really are all in this together and you're not alone. Disability and chronic illness is such a spectrum, like we said before. And we're never going to truly know what it feels like to be in another person's body. And I mean, it's been a roller coaster of, like, granted, I've never been this healthy since I was literally in elementary school. So I'm still kind of adjusting to like having this like good quality of life again, for a sick person at least.
Yeah.
But I have had phases where like I was bedridden, screaming, crying in pain, begging my parents to let me stop treatment. Like I've been in those dark lows, like where I resembled like a CRPS patient. Like that was one of the differentials they were putting out on the table in high school, but it was really untreated Lyme. And then like myalgic encephalomyelitis was one of my misdiagnoses when I was bedridden. When I was at my lowest, it was just the only thing I had left was just hope. Like just every day, just like, I hope one day I get some symptomatic relief. I hope that I go from 5% functional to 10% functional. Like I hope that I hope that I can go sit in the kitchen and my mom can cook me dinner. Like this, just hoping for the tiniest things, like finding little pockets of joy in your day, which can be the smallest things. Like, hey, I was able to listen to music today. Like I'm sure you get that like from your wife's experiences of just the tiniest little things. Just trying to fixate on those little pieces of joy in your day, like something to look forward to. And then just like for those people, just let it themselves feel how they feel. Like mourn, be angry, be sad. Like definitely get access to a professional to vent to, but don't be afraid to like vent to friends and family. And
Yeah,
it's
a
so
spouse,
important.
whatever, partner.
It's so important to find a community online. Like that has been the game changer for me, is because like, yes, as I got older, especially because a lot of my chronic illnesses were visible, which I think helped make people take it more seriously. Like, hey, she had surgery and she's in a wheelchair. Like, oh yeah, she's definitely in pain, which it shouldn't be that way. That has what's been the biggest help for me, especially during the pandemic, because I live in complete isolation. Because like, even, I mean, now the vaccine efficacy has waned regardless, but even vaccinated with my specific antibody deficiency, which I also developed the IgG deficiency from Lyme being untreated my whole life, I don't mount a good response to vaccines, period. So it's like I live in isolation. Even like people who are so careful in my life, like my parents, they work in a dental office, they're high risk exposure. So I just can't safely see people, because it's like, why would I risk losing all this amazing progress I've made, like just to get COVID? So I'm very physically, I'm doing well, but mentally I'm like super lonely. And the only thing that's really got me through is just like connecting with other people online. And I think that it's so therapeutic to just be able to, like, instead of screaming into the void, you're like screaming into the void back
Yeah.
to someone who is
Yeah.
like, I feel you. Like they're just like, yes, yes. Like I
Yes.
keep the energy coming. I retweet. So it's just, I think it's like therapeutic to find people who are like,
Yeah.
hey, I've been on that level of suffering, or I am on that level of suffering. Because it's even though it's not going to make your suffering go away, it's like, I'm not alone, I'm not the only one. And I know that we all feel like we are the only ones, because so many of us are hidden away, and like people shame us for sharing that we're suffering, and they view it as some pity party, like, and stuff like that. And it's like, no, this is just our reality. And so I think that people suffering to that degree, if they were able to just have a safe space to vent and share their story, that they could at least have some emotional release, even if they don't get physical relief, because emotional pain can make your physical pain worse.
It's true.
I am obsessed with Dr. Horowitz. If you have Lyme disease, you should look into Richard Horowitz. He's one of the top Lyme doctors in the country. He's a wealth of knowledge and super empathetic. I don't know him personally, I'm just obsessed with him. Okay. I would want people to be as gentle with themselves as possible, and like I said, the positive affirmations and not talking negatively to yourself. Like, I don't want people to ever put the blame on themselves, or to feel like they did this to themselves or anything like that. If they're newly sick, I would say that's some great things I would recommend is like looking into like Facebook groups for crowdsourcing if you're trying to find a specialist you need, or there's some like pages on TikTok and Instagram with like hacks for chronic illness. Like I know I follow a woman with arthritis, and she shares tons of like devices to help you open things with your pain in your hands. Like it's just, I would really say like reach out to elders in the community so that they can help you start unpacking like internalized ableism, because that's something that you want to hit on hard and heavy so that you won't torture yourself down the line. Because if
Mm-hmm.
you come in with that severe internalized ableism, you're just gonna like mentally fall apart, because you're gonna blame yourself, you're gonna be angry at yourself, like it's just gonna put you down a dark path. So I would say that's a really important thing, is like reaching out to the community, and then just know that no one is going to fight for you the way that you fight for yourself, and that you are worth it. Even though the healthcare complex will make you feel like you're not worthy,
Mm-hmm.
you are, and you are deserving of any of the healthcare needs that you have. So I just want to reiterate that to Americans, because I know that we are all like taught that we're just like another body, but you matter and you deserve relief, and never give up.